Okay, this is Chelsea Baggett, and this is my table of contents for my medical SLP Resource Binder. I have saved most of this on my computer, so I just created one document that kind of outlines everything I have, and I'm going to briefly go through it and kind of go over why it's in there and what exactly it is. So I started up here with some things from ASHA, the scope of practice, the medical review guidelines, and the code of ethics. I think those would be important to print out and just have as a quick resource for things like that as you're going into the profession. Here I have saved all of our class PowerPoints. These are just where I've taken notes of things that you've told us in class, things like that. I've also saved our quizzes under here as well. My next section is dysphagia. So I'm currently in my medical placement, and I'm realizing that it is mostly a lot of dysphagia. I'm in an acute care setting. So most of these have actually come from my dysphagia class that I had last fall. I did go through and add a few things, but we had to do a resource binder then, so I kind of went off of that. So we have a screening checklist, the 4-finger method handout. This kind of explains palpating the swallow, why we do that. Bedside evaluation paper forms, if we need to fill those out. A scale for penetration, aspiration. This is a PowerPoint that really outlines MBS and things like that. Intervention grid, we created this. This talks about different diagnoses that you might see, different types of dysphagia, and what you would do as an intervention. These are the levels, diet levels you may have. So these are handouts that you may provide to a patient or a caregiver. A handout on Fraser water protocol. Thickened liquids and suggested thickeners. So these are a lot of patient and caregiver education, realizing that we pass those out a lot. So I thought that was really helpful to have. Pediatric dysphagia PowerPoint, infant versus adult structures diagram, some pediatric dysphagia resources, dysphagia goals. Starting into the profession, I think it would be important to have those sample goals available until we get more comfortable writing those. Those evidence-based dysphagia exercises that we got in this class. And I've also added here a copy of some oral motor exercises that we can do with our patients with some weakness as well. E-STEM dysphagia PowerPoint, the FAQ about alternative nutrition and hydration. I'm realizing I get a lot of that in my setting now, so I enjoyed that. And then in my placement, we do some NICU feeding. So I have done some research on how we do that, and we use the sideline position and pleasant feeding experiences, and these are both handouts that can be given out to parents that I have found. My next section was voice and resonance. So I have this Ann-Kummer handout. It talks about different types of craniofacial abnormalities as well as cleft palate, things like that. An article that talks about the top 4 cleft palate speech therapy strategies. These 2 articles that we got in class. Passenger speaking valve information packet for an SLP. So it goes over kind of evaluations, treatments in regards to the passenger, as well as a information packet for the patient caregiver. And then a diagram how to clean the passenger speaking valve. One thing I've quickly learned that I need to pick up more on is terminology. So I took the terminology PowerPoint from dysphagia class, as well as the list given in this class, the glossary, and then I've also added my placement is at Cox Health Hospital, their acute care terminology list. Added that into this as well. And then these are some copies of assessments that I would have on hand for sure in a medical setting. Burns left and right, COQT, and the MOCA. I'm sure there are a lot more to choose from, but these are the 3 that I have found that I use most in my setting. So depending on where I would end up, I could easily add to that as needed. So that's kind of what I've included in my medical SLP resources that I have saved either on my computer or printed out. So that's it. Thank you.